when you have a heart attack, it is almost like an elephant sitting on your chest. That is the sensation you get.
How do I know I'm just having a panic attack and not a heart attack?
Okay, so you can never absolutely know, okay? But I can give you tips on what I think when I see someone and how I work out whether, by far, things go wrong for 4 reasons, okay? And those are the 4 things I look at. Age. So if I see someone who is 20, who is complaining of palpitations or chest discomfort, I automatically think it's not likely to be a heart attack. Heart attacks are largely a disease of older people. But if someone were 80 and they complained of chest discomfort, then that would be the first thing that would go through my mind. Could it be the heart? 20, it would be the last thing on my mind. So who you are, your age is really important. And the second thing is your genetics are really important. Now, if you are someone who comes from a background where your family, every member of your family is dropped down dead of a heart attack at the age of 25, then I would take that a lot more seriously. But if you're otherwise well and there's no family history of any issues, then that makes it very, very unlikely. And the third thing, I guess, is lifestyle. I look at the patient's lifestyle, and if so, someone is, a heavy smoker, who is very overweight, who has diabetes, who has high blood pressure, then that makes it a lot more likely. If, on the other hand, they're otherwise well, they play football every day, they're thin, and they're, then that makes it very unlikely that they're having a heart attack. It's always a good idea to get checked out if you have these symptoms. Largely for reassurance if you're otherwise young and otherwise healthy. The other thing I would say is that most people who have heart attacks, when you have a heart attack, it is almost like an elephant sitting on your chest. That is the sensation you get. It is not a pounding in the chest, boom, boom, boom. That's not what heart attack. People will say, I feel like there's an elephant sitting on my chest. I feel it feels raw and feels sore, and I feel clammy, and they feel nauseous. Nausea is a really big feature. And it's almost a feeling of impending doom. They feel like something is really wrong here, and they go grey. So I can go into a casualty department and I can tell who's having a heart attack just by the colour. They actually go grey. Whereas people who have panic attacks, the symptoms are very dramatic, they're boom, 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 your hands are going, you start developing tingling and pins and needles, and you automatically think, oh, pins and needles equals heart attack. But no, I think it's who you are by far, your age, your risk factors, your family history, and then secondly, the nature of the discomfort is very important. People who panic will complain of pounding, they'll complain of stabbing pains or a vibration-like pain. They may complain of localized pain on one side, whereas people who are having heart attacks will complain of almost like being squeezed or crushed or something sitting on their chest.
That's good to know, because generally what comes up most is that pounding heart, or maybe it's the skipped heartbeats, all of that, but it's the heightened activity of the heart that's really scaring a lot of people who are in the fight or flight response.
That is very rarely ever the cause of it. That is very rarely ever the presentation of a heart attack. It is always either a real discomfort or a heaviness.